Okay, so welcome to the class. Now this is the class for part 3 as your exams are coming. So it is good that some practice to be there. So like Shaishta, you can start. And this is a task number 1. And there are 2 papers. And I'm starting the 2-minute timer, okay? 1 paper and I have got 2 paper.
Right, ma'am.
You guys can call your friends also. Can share the link. There are 2 papers. When you'll say I'll change the paper.
Ma'am, next page.
Request to all of you, please you mute your mic. Somebody's mic is on. Please mute your mic. Okay, time is over. You can start. I'm setting 10-minute timer. Start.
I am Dr. Shaisa, one of the doctors in the postnatal care today. Please confirm your name and age, please.
Yeah, I'm Anna Red and I'm 35.
How may I address you?
Hey, you can call me Anna.
Ina, I have seen the GP record that you have delivered 5 weeks ago, and now you are here to discuss the result of your baby. Am I right?
Yeah. I'm quite upset because I got to know that my son is tested positive for the cystic fibrosis.
I'm so sorry to hear about it. We are here to help you out and support you, Anna. Is it okay if I ask you a couple of questions before going to your result report?
Yes.
So, how are you coping after the delivery? Any bleeding or pain?
No, that's settled now.
Mhm. Um, could you tell me more about your delivery?
I had vaginal birth, doctor.
Was it normal delivery?
Yeah.
Could you tell me more about your pregnancy? Was that unaffected pregnancy, like uneventful? Any
The
complication at that
pregnancy,
time?
no, the pregnancy was fine. It was a flawless pregnancy.
All right. So your follow-up was with midwife, right?
Yeah.
Mm-hmm. All right. Ina, may I know the name of your baby? Have you named the name?
Yeah. Baby's name is William.
Is William latching well?
Yeah.
Mm-hmm. All right. Do you have any complaint like pain in the legs or the breast or anything for which you are worried?
No.
Any cough or
No.
problems with opening of the body?
No.
All right. Do you follow your GP for any medical problems? like repeated chest infections or repeated bouts of diarrhea, constipation?
No, nothing.
All right. And are you up to date with your cervical smear?
Yeah, I am.
Any surgery in your tummy or down below?
As a child, I had an appendix operation.
All right. Was it open surgery or keyhole surgery?
It was a keyhole surgery.
And how was the recovery after that?
That's fine.
All right. Are you allergic to anything?
Uh, I am allergic to aspirin.
All right, and I am going to note down this. All right. And
Mhm.
moreover, do you smoke or drink alcohol?
No,
Pardon me for asking recreational drugs. Your blood group?
O positive.
Any reservations related to blood transfusion?
No. Would I require any blood? No.
No, no, there is no need, but if required, because we have to keep in our record that inquiring.
Okay.
And is there any family history of concern, like some genetic problems, cystic fibrosis, or someone who is having repeated chest infections? Any genetic problem in your family?
Yeah, my brother had genetic fibrosis, cystic fibrosis.
How old is he?
He is like 25.
All right. How is he coping? Is he fine?
Yeah, it requires lots of treatment.
I'm so sorry to hear about that. And what about your partner? Is he fit and well? Any problem with him? Any
My
genetic
partner is
problem?
fine.
All right. Your weight
Yeah,
and height,
my partner is 25.
and what do you do for living in?
Yeah, I'm a school teacher.
How is the support at home?
Yeah, quite well.
And good to know that. Have you ever felt down, depressed, or hopeless in the last couple of weeks? And
I'm quite upset when I get to know my baby result.
Mhm. I'm going to put you in touch with counselor, and I believe you will be relieved after talking to him. Will that be okay?
Yeah, that's fine. Yeah.
Thank you very much for the information. Would you like to add anything else?
Yeah, my partner is carrier for this, and I am as well.
Okay, so you are well aware of the result of your son, right?
Yeah, I know that.
Mm-hmm. Yeah, so before going to discuss your report, I'm going to ask my nurse. She will check your well-being. I will check your tummy. How is your womb contracting? Now come to your concern, and would you like to involve your partner or anyone with you? Because I have to discuss a lot about the result.
Yeah, that's fine. I can handle.
Mhm. Otherwise, I can ask my nurse Sarah. She will accompany with you.
Okay.
Okay. And now come to your concern is you are well aware of the condition. Uh, your baby is positive for cystic fibrosis, and you both are carrier for that. So,
Yes.
was there any this genetic testing was done before pregnancy or in the pregnancy for the carrier?
Yeah, yeah. Like beforehand, I know.
Mm-hmm. All right. So, if both, so what would you like to know about the cystic fibrosis? Do you have any idea about this condition? If your brother is also affected with this condition?
Yeah, I'm quite upset to know that my son has got positive for it, and I would like to know what kind of life my son will have, how he will suffer, and what should I do for the next future?
Yeah, your concern are quite valid, and I would have been the same. Being a motherhood, your concerns are valid, and so as you both are carrier in that case, your baby is now affected. The risk is 1 out of 4 babies, and unfortunately, your baby is having this condition. If both parents are carriers, in that case, um, uh, one per 1 out of 4 babies they are affected. 1 out of 4 babies um they are normal, and 2 out of 4 babies they are carriers. Carrier means they can transmit the gene in next generation, but they are not affected. So now, if your brother is already affected, so because of this condition, this is a quite common condition in UK, and we have good support services and social services in this condition. Your baby might be affected by repeated chest infections, repeated bowel problems, but don't worry, the baby will be managed by a team of doctors. Am I clear so far?
Mm-hmm.
And I will refer your baby to the baby doctor. He will guide you further about this condition. And moreover, um, as baby is affected, so there are more chances of offsprings from your child to be affected, and they have sometimes the limited life expectancy. I'm so sorry to inform you about that as well. If there is no good care and the
So,
condition
how
is
much
worse.
less? How long my son will live? So my son is going to die.
I can't predict it before. And I have seen many even children with this condition. Still, they are survived. They have a prolonged life. But usually, the life expectancy is limited till 25 to 30 years of age without good care.
Okay.
I'm so sorry to tell you because I have to be honest about the facts.
Yes, yes.
What would you like to know? Any further information would you like to know about that?
Okay, time over. Okay. Good attempt, Shahista. So, how you did?
Ma'am, that was literally whatever I was speaking, and that was my
Mm-hmm.
only the report knowledge. Uh, and I was not prepared, and I didn't read this recently. It was only my part two knowledge which I was implicating here. And in the end, I was a little bit confused, so I didn't give her information leaflet, support groups, and writing back to GP.
Okay, very well attempt. Very well done, Shahista. But the other mistakes are there. So, like in the information gathering, so this is quite big station. You have to explain too much to the role player. So information gathering, you asked details of surgery. So whether it was appendix surgery long back as a childhood, now it is not correlated with the condition. So too much detail you should not ask that time. You can just just say one thing and go away because you have to gather save time. Then this is postnatal patient 5 weeks asking about blood group, asking about Jehovah Witness that was not required at this stage. Neither you are going to give any blood to her right now, nor you are going to get, nor you are she is a candidate for any NTD. So like in you have to take relevant history. There would be some points in some of the station that would not be necessary. So you have to omit that. Okay, then like um, she was upset, the patient was upset. She said because my baby has diagnosed with it, so just instead of so just kind of explain the things to her rather than for counselor. Usually if the patient is mentally upset for any other issue, when you don't know the reason, that time you bring the counselor. Apart from this, you said that you would examine, but there is nothing to examine. What you will examine this woman? Basically, she is a postnatal patient, but the station is not gathered around the postnatal because she's already 5 weeks. So you have to take a little bit, um, knowledge about her postnatal well-being. But too much knowledge and too much examination is not required because the station is not about her. The station is about her baby. Okay, so this few things in the I have to say applied knowledge. Yeah, a lot more thing has to be said that I will tell. And one thing you said that his offspring will be suffering from the disease, but the male with the cystic fibrosis, they are infertile because the duct is blocked. So that was another uh, like that was not a correct information. And the main concern of the role player is that how my baby is going to be affected. So you have to kind of say a little more detail how the baby is going to be affected and what the plan can be put so that to make the baby comfortable. Apart from this, she wanted to know that what will happen future. So you have to give idea that what can be done for her so that like what kind of test can be done for the future pregnancy because she is quite upset. Apart from this, the patient is like in the information gathering, you could have initially asked any like cystic fibrosis. You can start if you start the station with a cystic fibrosis history. That time, okay, you will save time because initially she will tell that me and my partner is carrier. So too much you will save that time in the like time only. Okay, so these are the few things I had to say for you. Okay, Shahishta, is it clear?
Yes, ma'am, very clear. You are very right.
Yeah. Because you can understand that it is only 10 minutes you have, and in the 10 minutes you have to like cover your all thing, because if all things are not covered, then also how the marks will be given. Okay, so yeah, rest is a good attempt. Now I'll just take you through how I will do. Okay, so hello, Anna. I'm the doctor from the postnatal clinic. I can see that you are here because your son has diagnosed positive for cystic fibrosis. Is it so? And I'm really sorry about that. So, like apart from this, also I can understand that you want to know about how the cystic fibrosis will affect your baby and what can be done in future. Is that so? Apart from this, any other concern you do have? No. Okay. And before I can answer your concern, I would like to gather some detail from you. Will that be okay for you? So, Anna, have you got any idea about cystic fibrosis? Anyone in your family having the cystic fibrosis? Your testing has been done. Your partner testing has been done. So she will tell you immediately that me and my partner both are carriers. Okay, so your life is a little easy because you have the important information has already been taken. Apart from this, I can see that you delivered your baby. You delivered William 6 weeks back, 5 weeks back, isn't it? So, how you deliver? Any trouble there? And are you breastfeeding? Any problem? Any issues with the bowel? Any issues with the bladder? Are you sleeping and eating well? Okay, and how you deliver your son? Okay, and a very important thing that you have to ask is the parity. So, William, your first baby, or you have got previous babies also? And have you resumed your periods after William's birth? Okay, so any contraceptive has been started or something like that? Are you fit and fine otherwise? Any regular medications are you taking? Okay, and like someone is there to look after you, support you. Okay, so Anna, I'm going to give you a lot more information today about cystic fibrosis, how your son is going to get affected, and also what can be done for the next pregnancy. So, do you want your partner to be there with you? Okay, so let me give you some brief idea about it. So, cystic fibrosis is an inherited condition, and you get it from your parents and you can pass it over to your children. So usually like two faulty genes are required to show the symptom of disease. As you if the carrier means that you are a carrier, your partner is a carrier, that means both of you carries a faulty gene. So now your baby inherits two faulty gene. Because of that, baby's confirmed diagnosis has been confirmed for cystic fibrosis. This in the medical term we call as an autosomal recessive condition. Is it clear? So actually what happens, it affects the gene, and it affects the gene that is responsible for making a protein that will regulate the amount of sodium and chloride. These are the ions that move in and out of the cells. Because of the fault in that function, the secretions in the body, they become sticky. Okay, so at right now the baby is fine, but because of this condition, what can happen later? As the secretions of the lung, they become thick, so a possibility of having lung infection is there. But we do have medication. The baby may require antibiotics. There's certain medication to clear the mucus, or the secretions from the lung. Apart from this, certain medications are there in form of the bronchodilator. So they usually help, and also the certain physiotherapies can be done. So yeah, it can be managed that way. Apart from this, it affects the digestive system. Because of that, the sticky secretions of digestive system become sticky. Because of that, helping like absorbing fat becomes difficult, and poor maintenance is there. So most of the babies who are affected, they may require some digestive enzymes or supplements, and the monitoring for the liver complications. I mean, clear about that. Very in very small number of baby, sometimes the bowel obstruction can be there. So baby may require some admission for a time. Sometimes surgery may be required. And as the nutrition is already getting affected, so there could be weak bones, but good nutrition and exercise helps the bone to keep healthy and strong. And like some important information I would like to tell. Actually, in the males, the tubes are there that carry sperm, and usually this if the male baby is affected by cystic fibrosis, so the tube that carries sperm would be blocked. So in that way, having their own children sometimes becomes difficult. But so many options are there, and like sometimes they may require some donation also. So these are the few ways the baby can get affected. And there are certain recent advances in the treatments are there. And so most of the babies, their life is comfortable. And you are not alone in the situation, because there are certain teams are there who can help you. And there are certain support. I can give you certain support group links also. We do have cystic fibrosis trust, we have cystic fibrosis kit, and cystic fibrosis care is there. Am I clear about that? Any other concern about the baby you would like to discuss? The next concern, another concern you do have, that what will happen next time. So, like as you and your partner both are carrying the faulty gene, so 1 in 4 you may have like normal baby without any cystic fibrosis. Two babies out of four may be a carrier like you, carry the faulty gene, and there is 1 in 4 the chances the baby can be affected. So like if you so there are a couple of options are there. So before you plan for pregnancy, if you consider going for an IVF pregnancy, so some cell can be taken before the baby is put into the womb, and the tested whether the baby has got cystic fibrosis or not. So that is a pre-gamete testing is there. This is one kind of test that can be done before the you baby's born, before the baby is put in the womb. But yeah, this would require IVF, or the assisted reproductive technique. On the other side, if any woman is pregnant, that time also some needle test can be done, and that will help also to find out whether the baby is affected. So more detailed discussion can be done by the expert person. We do have them. I can put you in touch with them. Okay, so that's all I'm here to speak about. Any concern you do have at this stage? So and I know it is a very difficult situation you are in. So, I can give you the link to the all support groups, and so that you can be the part of it and some written information. We can fix up a next meeting so that you can come up with your family member. So, whatever the discussion is left, we can do it next time. Thank you for speaking to me. So, is it clear, Shashta?
Yes, ma'am. A lot of mistakes done by me.
Not an issue.
Thank you,
Any one
ma'am,
of
for
you have got
clarity.
any question? Yes, yeah, yeah. What you're saying, Saishta?
Thank you so much for clarification, ma'am. So kind.
Okay, okay, okay. Welcome, welcome. So, any one of you have got any question?
Ma'am,
Yes,
ma'am, can I ask a question?
yes,
Ma'am,
yes,
this patient, she was aware that she was aware that she's a carrier and her husband was a carrier. Why was
yes.
amniocentesis CVC not offered to her? And are we going to? Madam, I feel if we ask a history, we have to ask about where did she develop, where should she delivered, and if she was delivered in NHS, we have to initiate the incident report and inform the people that we missed that case. We have to give her a link to pals to inform. I mean, if she was aware that she is a carrier, we should have detected this baby.
Maybe she that you have to find out in the scenario that whether she attended the preconception counseling or not. Sometime preconception counseling they have not attended, and sometime they refused for any kind of testing. So that information you have to find out from the role player. If she was offered preconception counseling, and if she was discussed about the testing, and if she refused, that time there would be no incident reporting because no mistake has been done from the hospital side. So like that, the role player will give you answer about that. Okay. So
Ma'am, I have a
incident,
question.
Yes, ma'am.
yes,
Yes, ma'am.
incident
We
incident
have
reporting.
we have to.
Yeah, 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 yeah. Yes, yes,
Yeah.
who is asking?
Ma'am, what to say when she asks, "Is my baby going to die?"
So, like previously, very previous, early, like few years back, they have got short lifespan. Okay, but now the lifespan is increased because of the increased care. So, baby is not going to die now. Okay,
Okay, okay,
they
ma'am.
Yeah,
have
Ma'am,
long
thank you.
as compared to other people. You have to say, yeah, yeah. As compared to other babies, as compared to other people, they do have a lot of short lifespan. But these days, so advances in the treatment are there. So most of the people they live comfortable life. So this way you have to answer. Is it clear? Is it clear?
Yes, ma'am.
Any question?
Yes, ma'am.
Yes.
Thank you.
Any one of you have got any question with this, or
Yeah.
we move ahead?
Dr. Priyata, I have a question, please.
Yes.
Why we didn't go for, rather than invasive tests like amniocentesis or current villi sampling in fetal medicine unit, I think there is possibility now more diversion toward non-invasive tests like CCF DNA in the maternal blood, especially for single gene defect, not only for, chromosomal abnormality. Now, I think in Western society they have this test for a single gene defect.
Yeah. So we can. That I have to review whether CC like free fetal can detect cystic fibrosis. Then that could be given as the option also.
Yeah, now they use it, especially in Ireland. Like for Ireland, because I have my colleague there, she say if the mother is supposed RH negative, they go
Mm-hmm.
immediately to
No,
the
no, no.
fetal.
RH.
Yeah,
See,
yeah,
RH negative. RH negative. RH negative. They are very well. They are
yeah,
detected by free fetal DNA.
yeah, yeah.
They are
For
detected by free fetal DNA.
Yeah. So even in UK, I don't know in UK, but I mean there is possibility for single gene defect like sickle cell disease and cystic fibrosis to go non-invasive rather than invasive. It's high accuracy, but I don't know really. I read one time like that, but I'm not confirmed.
Yeah, but like it can be done, but whatever this I read few of the papers, but I didn't find that. I find this PGT and invasive only. Maybe CCF DNA that much is, that much it won't be that much correctly to tell cystic fibrosis. It will
You
not
mean
be
like,
definite.
yeah, I think
Yes.
maybe not like I mean Down syndrome and other. Okay.
Yes. Apart from this, like this woman, as she already have a baby with a cystic fibrosis, so she would go for definitive thing because she will not like another baby to have with a similar condition. So going for PGT or going for immuno or like NCVS, she will get the correct answer about that.
Yeah. Okay.
Okay.
But
Yeah.
maybe there is possibility, or they will take. I mean, maybe would advance in this
Yeah,
field.
for possibility you can say, but if she is looking for definitive test, so definitive test these are only.
Yeah.
Okay. Yeah.
Okay.
So should we move ahead?